Good evening, everyone. It's Wynn Brown here with Heywood Healthcare's COVID-19 update for Monday, January 25th. I hope you all had a good day today. I just want to give you an update on COVID vaccinations coming up. So Heywood, along with the boards of health in our local region, are working on the completion of phase 1 vaccination as we continue planning to move into phase 2 and creating vaccination clinics in our region. So we do have a limited number of Moderna vaccines available, those who are listed in phase 1 of the target populations. So if you are someone on our Heywood team or in our community who qualify for phase 1, you may visit our websites, and on our websites, www.heywood.org/COVID-19 vaccine, you can sign up for the Moderna vaccine being offered for phase 1 on Thursday, January 28th at Athol, and on Monday, February 1st at Heywood. Again, these are phase 1 patient-facing staff and individuals who work with patients that are listed in phase 1. And then you need to show proof of phase 1 status. So if you are an EMS, first responder, you need to bring proof of that. So anybody in the community just can't sign up for it at this point in time. That's not allowed. And we only have a limited number of vaccines. So if you're phase 1, working in a dental office, those kinds of things, you can sign up for that, and the link is there. There's also a graphic here of the phase 1 group, so you can take a look to see if you qualify. Also, Governor Baker and his administration came out with an announcement today for the beginning of phase 2 vaccination of the general population age 75 or older beginning next Monday. So you can find out about that. I'm not sure if our region will be fully available to have that set up yet, but we are working very quickly and working with our local boards of health to set up 1 or 2 vaccination hubs in our region to get that done. As you can imagine, it's an incredible amount of work. It's not just your regular flu clinic where you come in and get a shot in your arm and go on there. You have to get set up for a second dose, and there's other things that go along with that. So it sounds easy on paper, but it actually has a number of really intricate things that need to get done to do that. So please be patient with us as we stand that up in our region. As we look at Heywood Healthcare, we have 2 patients in the ICU at Heywood and 19 inpatients. So that adds up to 21 for you and me, down from our peak. And we also get daily numbers from our region, and we do see us cresting downward. Hopefully that trend stays. Our 7-day rolling average, though, wouldn't tell you anything different than what we've been looking at. We are at a 7.55% positive versus the state at 4.85. So we continue to trend above the state. There's some other statewide data in here for you. There's also a video included with this that I meant to include last week, but missed it. But it is a video of the lease signing agreement on January 14th with Gardner Mayor Mike Nicholson, which signed the authorization for the city to lease us land at the south side of our campus, as well as some signatures to release deed restrictions so we can build our new 6 OR operating room pavilion addition on the south side of our campus to really fully upgrade that piece of our infrastructure to better serve our region. And there's a video for you to take a look if you're so inclined. And just some words of gratitude for Heywood Hospital on the Facebook page. So just want to read a few to you, especially to our staff who view this so that they know people are thinking of them. Many thanks to all the staff at Heywood for all you do for the community. We appreciate the continuous, exhausting effort to heal and keep us healthy and safe over 2020 and now in 2021. Thank you from the bottom of our hearts for all you do every single day. You are all our heroes. That's really sweet. To all our doctors, nurses, techs, office staff, and everyone behind the scenes that keep the place running, thank you so much. You are the best, with a okay little emoji and a heart, so thank you. And we are so fortunate to have Heywood Hospital, and I would add to that Athol Hospital, the Quabbin Retreat, and Heywood Medical Group as a shout out to everyone in the Heywood family, so thank you. I hope you have a great evening. I look forward to talking to you later this week and giving you an update to where we are as we continue our journey to be one of the best community-owned health systems in America. Have a great evening. Thank you.